If you can make it, is it this one? This one?
Full screen.
Full screen.
This one.
Yeah.
Up.
Okay. Can you see this?
Yeah.
So the topic that I want to cover today is called domestic violence and mental health. Okay. So how much do you guys know about domestic violence? Having come across as any domestic violence cases?
I'm not come across
No. Why is that? Is it because the domestic violence is more related with social stuff, not a mental health stuff? What do you guys think? Does it have any relationship with mental health, domestic violence?
Yeah.
But can you say, all the domestic violence purely happens because of mental health problem?
No.
Why? What could be the other reasons why domestic violence happens if it is not just mental health? Are there any other reasons why domestic violence happens? So this is some of the things that we'll discuss more in detail in this presentation. Yeah. If you can just next slide. So there are 5 areas that I want to cover in this. Okay, we might not see more of a domestic violence, especially in the older population. But if you guys work in general population, and especially if you work in like perinatal kind of thing, you'll see a lot of domestic violence. So first of all, we need to understand what domestic violence is. Okay, in order to understand, in order to know about anything, first you need to know what we are dealing with. Yeah. So the second thing we'll discuss about what would be the other roots of domestic violence. So it's not just the mental health, there might be other reasons why the domestic violence happened. So the third thing is we need to also understand the complex relationship the domestic violence have with the mental illness. The fourth thing is we need to understand how we can address domestic violence through the mental health lens. And the number 5 is we also need to think about how we can prevent domestic violence from happening in future. Okay, so these are the 5 things we'll cover more in detail. Next slide. Yeah. So first of all, we need to understand what domestic violence means. Okay. Please don't confuse domestic violence with child abuse. Yeah. So they are separate kind of boxes. So domestic violence, in a simple term, this is a term which I've taken from HMRC, which is defined in the social sector. So domestic violence, for domestic violence to happen, you need to have one or more actions of repeated pattern. It's not just one-off. Okay, it needs to be in a pattern. And the theme that goes is control and power over the current or former partner. Okay, so keep in mind control and power. Okay, they need to keep them within the box. And domestic violence doesn't mean just current; it can also be with the ex-partner. Yeah. Now keep in mind the responsibility always lies with the perpetrator. That means that if anything that they do, they should also be accountable for the action. Yeah, it's not the victim; it's the perpetrator who does, and it's against the law. It's not justifiable. It's not acceptable behavior to accept and say, domestic violence we would accept. It's a culture to accept. Yeah. So any questions on domestic violence? Is this concept clear to everyone?
Yeah.
So the concept is it needs to be repeated pattern, control, power, and it can be with the current as well as former partner. Yeah. Can you go the next one? Forget about these terms. Yeah. So what do you get from this one? Physical. Okay. How do you define physical? What is considered as domestic violence physical? Can you give me some examples?
Anything that might harm the victim, like cause them physical harm.
Physical harm. Is slapping considered?
Yeah.
Slapping, kicking, I've seen some cases where they also take the nail out, just to give problem. Cigarette, yeah. So domestic violence doesn't just means like a physical kind of thing, even a small thing. If it caters, repeated pattern, control and power, that can be classified as a physical one. Yeah. What do you get from this one? Verbal. Okay. This just saying you're stupid, does that cater as a domestic violence? Stupid.
If there's a repeated
Pattern, control and power. Yeah. And keep in mind that sometimes it's considered that okay, you can say this or that, but if those elements are involved, it is classified as domestic violence. Yeah, and keep in mind that this we see a lot of toxic relationship. Yeah, and when we talk about current partner, it doesn't just mean when you get married. Okay, it can also be boyfriend and girlfriend. Yeah, what do you mean by this? Sexual, without any permission, without any consent. Yeah, what do you mean by that? Financial, yeah, controlling, like all the salary you have, just take it all. And this kind of abuse you also see in cases of like when drugs are involved, where they take all the money and don't give any money to the other partner. Yeah. Keep in mind that now beside this four element, we discuss about the physical, we discuss about verbal, we discuss about sexual, we discuss about the financial. There is one more thing. The new term is spiritual and technological. Do you consider this can also be an abuse? Spiritual.
What does that mean? Forcing to be in a religion?
No, spiritual means religion or in cult. Does that make sense? So I believe on this idea. Okay, you also need to believe. You don't have any choice. Okay, locking them and say, okay, you need to follow whatever I say. Yeah. Technology is also a big issue now. Limiting someone's access to internet. Taking control of their Facebook ID or Instagram and posting, pretending to be them and posting. Okay, so currently I've seen a lot of this technical kind of thing, especially in toxic relationship. What they tend to do is they take the partner's ID and they call and pretend to be like a male or female and call the other saying that I'm a prostitute and come to my house. So this kind of things is happening very common. Yeah. So are you clear about different types of abuse? Yeah. If you go to the next slide. Okay. So this is the data which I've taken from last year. Yeah. So you can see that overall, 60 million in UK they are going through domestic violence, but so sometimes this kind of cases don't come to the surface, and we are not aware of it, but a lot of things are happening. Yeah, keep in mind that 9.9 million are repeat. This has happened, but they are repeating again and again. Yeah, emotional abuse, threat, economic, domestic stalking. Domestic stalking is seen more with the ex-partner. Once they end up the relationship, they still think that and especially it happens with the male. My ego is hurt, and they try to stalk. Physical abuse, domestic, sexual abuse, health abuse. Can you give me some example of health abuse? And there was a very big case, recently I was going through the case where girlfriend didn't allow a boyfriend to seek medical treatment for cancer. Wow. Locking them and saying you should not go for it. Yeah, and pouring hot water in the head.
Would health abuse be, I mean, I've seen it in like TV shows where they like give them like tablets and then that causes symptoms to make them think that they've got an illness. That would be health abuse.
That would be also a health abuse.
Right.
Yeah. So forced and preventable marriage. This is seen more in the cultural kind of thing.
Yes.
Yeah. Okay. Any questions on this? No. Yeah. Next one. Now there are some of the things that which is hidden, which causes this power and the control to still go on. It might be gender inequality. Okay. Still a lot of the cultures are patternistic. Yeah. Cultural norms. In some culture it's considered as normal. Yeah. Just to tolerate the domestic violence. Legal gaps. Sometimes people are not aware of how to seek the legal gaps. If they are suffering, they don't know whom to ask for help. Community silence, where the community says, it's against our community pride. We should not disclose to them. Okay, so the community also has some issues. Yeah, can go to the next one. Now this, when I looked at it, there are multiple factors. It's not just mental health that causes domestic violence. Unemployment. If they don't have money in the house, sometimes it can flare up in the domestic violence. Financial stress, alcohol and drug abuse. Alcohol and drug abuse causes more of financial abuse. Imagine if there is someone with drug addiction is going to impact the whole family. It's not just that person. Yeah? History of abuse in the family. Can you give me some example how the history of abuse in the family can perpetuate domestic violence?
Because they think it's not. If they've
No.
seen like
Yeah.
the dad hitting the mum,
Yeah.
and then their boyfriend starts hitting
Yeah.
them, then
Yeah.
they're like, oh, that's just.
They might also think that this is the normal way we love people by hitting. Okay. Witness identify abusive parent as a child. Yeah. So that's the reason why if you have got children in the future, be careful how you behave to your partners. Yeah. Because the children they are they cannot differentiate between what is normal, what is abnormal. Yeah. Self-esteem. If people having self-esteem or ego kind of issue, it's also very common. Untreated mental illness. Yeah. When people have untreated mental illness, that can also flare up the domestic violence. Yeah. Strict gender roles and gender equality, which I've already discussed. Yeah. Non-existent social and legal policy. Yeah. When the policies are not very strong, especially in let us say in an Asian country, they don't tend to take cases seriously. Yeah. Low social capital, which I've discussed, cultural norms of and low academic achievement. Does this also have a role in domestic violence? Yeah, because if people are not that educated, they don't know how to address these issues. Yeah, so are you clear that they may increase the likelihood of domestic violence, but that doesn't directly cause it. So there's a difference between association and causation. What is the difference between association and causation? Is it same or different? Causation means directly A causes B, B causes C. Association means there might be multiple reasons, but this is one of the reasons. Yeah. So these are all the association. It's not a causation. Yeah. Go to the next one. Okay. So this is which I found in my community in UK. Because I do a lot of charity talks, and these are some of the barriers that I have found, especially whose language is not English. Language barrier, cultural barrier, and the children. They don't know how to respond appropriately, whom to talk, okay, how to help from external agency, financial, immigration status is also a very big thing. A lot of the people will say, if you complain, I'm going to send you back to the home. Yeah. And sometimes, when the perpetrator, does the domestic violence, they are also careful not to be recorded. Okay, so sometimes it becomes very difficult if you don't have the evidence to prove that someone has done it. Poor experience of the past. So in the past, when they have disclosed to the people and they don't take it seriously and they think that this person is just making up things, so that can also complicate the things. Yeah, family honor and within the family and community. Okay, so these are some of the factors. Yeah, if you go to the next one. Keep in mind that if the domestic violence are not addressed properly, it's a viscous cycle. It goes on and on and on. It's not going to stop on its own. Yeah. So the relation is complex and bi-direction. That means that sometimes the domestic violence is not just in one direction. It can be on both the direction. Okay. So you need to be careful that one person is not saint and one person is devil. Okay. It can happen from both the direction. So you need to be mindful that when you look at the cases like this, have a very open mind. Don't think that it's only the male who does it and the female doesn't do it, and you just side with the other one. Yeah. Mental illness may be the consequences, risk factors, and a tool of abuse. Okay, where I've seen a lot of cases where the partner make an excuse to do a domestic violence, saying that she's schizophrenic, she's paranoid schizophrenia. Okay, many people with mental illness are not violent. Keep in mind. Okay, having a mental illness doesn't mean that they will do domestic violence. Yeah, go to the next one. Now, from one psychiatric point of view, why domestic violence is important? Yeah, keep in mind that because of the domestic violence, it's going to cause psychological impact in a trauma. Yeah, a lot of people who goes repeated through this for a long time, they can go through PTSD and complex PTSD. Do you guys know what's the difference between PTSD and complex PTSD? Have you come across this term before?
I've heard of PTSD.
Yeah. Any ideas? Is it same or different?
So it is different. So
Yeah.
complex PTSD is something with there are features of EUP personality problems as well
Yeah.
associated with PTSD.
Yeah. So with the PTSD, post-traumatic stress disorder, some of the features you see is flashback, hypervigilant, reliving, avoiding the same kind of situation. And this happens when people go through any life-changing event which threatens their existence. Okay, you can see more in like, let us say, in a war kind of situation or accident. Complex PTSD is seen more, before the age of 25, where their personality are not fully developed, where they go through the trauma and they don't know how to handle it, and they can display some of the symptoms of PTSD. But as you said, there's also an element of personality disorder, emerging personality disorder. Yeah, depression and anxiety because of hopelessness and constant fear. They don't see any escape route, and they are trapped in that kind of mental kind of barriers or prison, and they think that there's no any way out. Substance, some of them they use substance, just to blank out or to escape. Yeah, maladaptive coping. Do you think suicide is very high in domestic violence? Yeah. Feeling of trapped and hopelessness. Dissociation. Dissociation means the trauma are too unbearable. Sometimes they go to dissociation. Just to blank out. You might see a lot of patients where they fake having seizures or epilepsy, doing this. So these are some of the things that might come if people go through domestic kind of abuse. Keep in mind that if you look at the domestic violence, it's not just the mental health side it impacts. The physical side it impacts. Okay, on long term, it can also cause problem with hypertension, irritable bowel syndrome, chronic. So in psychiatry, you see chronic fatigue syndrome, or unexplained kind of symptoms, unexplained somatizations. Because of that, also it can impact all those things. Yeah, and if it impacts the psychological thing, on long term, it can also causes problem with sexual. Okay, lack of contraceptive onset. So it can also increases the chance. Yeah. Low birth rate, prematurity, pregnancy loss. So if someone has gone through domestic violence and if they go to the next relationship because of the trauma, they can also impact their their life moving forward. And healthcare seeking. Sometimes when they want to seek help, they lose the autonomy to express fully what they need. Okay, difficulties in care and services. So unwanted pregnancy, abortion, HIV, some gynecological problem. These are all the things. Okay. On the long term, it imprints disability and even causes death. So please don't take domestic violence, lightly. It can cause a lot of serious problem. Yeah. If you go to the next one. Now you might see this, in the movie, where if someone hits and and after that, sometimes they will say, oh, it's just how I am. It's not an excuse to hurt people. I'm sorry. I did it. But and people tend to say, okay, it's one off. Let it. And then this pattern continues. Yeah. Be mindful. If someone does it on the first date, please stand your ground. This behavior is not acceptable at all. Yeah. If you look at it, some of the risk factors for people to do it is personality, lack of empathy, and entitlement. Okay, because those people who does this domestic violence, they might have some element of personality disorder. Cannot feel what other people feel, and they feel, I deserve it to do it. Power, substance. Okay, if someone uses alcohol and this, they lose their ability to control, and aggression is more than unmanaged trauma, hyperarousal, and irritability. Someone who have got unresolved trauma, sometimes they are always on a hyperarousal, irritable, and the risk of doing domestic violence increases. Choice, abuse is a choice. Accountability must come first. Does it make sense? No one should have an excuse to do domestic violence purely because they have got mental illness or other problem. They don't have any kind of, they should not be just let it go because of their problem, and they should not have any kind of, right to assault or cause domestic violence to others. So the accountability should always come first. Yeah? Even what we say, people abuse and this and that. We should say that this kind of behavior is not tolerated at all. Okay, so you need to stand. Yeah, go to the next one. Now, the mental illness as a tactic of control. So if you look from the psychological point of view, this is the cycle that goes. Okay, tension builds up. Okay, the second thing is the incident happened. And then, the reconciliation, they will say, oh, I'm sorry, this should not happen. So this phase comes. And then this calm kind of thing, it resolves for some time, and this pattern goes on and on and on. Okay. Gaslighting and inducing self-doubt. Can you give me some example of gaslighting?
It's like when you blame the other person for your actions.
Yeah.
Manipulatively.
Yeah. I hate you because you deserve to be hit.
Yeah.
Okay. It's because of your behavior. I have no any choice than to do this thing. So this is called gaslighting and causing a lot of self-doubt. Making them doubt their own decision. Yeah. Pathological normal trauma response. Sometimes they consider that it's normal. Let me do it. Yeah. Threats of involuntary admission or legal manipulation. They will say, okay, I'm doing this, but if you go to this, I'll put a case against you. Okay, involuntary admission, saying that I did it, what you are going to do.
Mm-hmm.
Yeah. Blocking access to therapy and trauma. If someone is going, blocking, from them reaching out to the people.
Mm-hmm.
Yeah. Next one. Now, moving forward, what we need to do. Yeah. So when we approach this kind of cases where you guys might come across in A&E or other services, the thing you need to do is, rather than asking what's wrong with you, what happened to you, so that doesn't see the blame of that person. What's wrong with you? That means that indirectly you are saying that the domestic violence happened because of you. The right kind of question is what happened to you. So at least it gives a sense of providing that comfort zone for the patient, so you can talk. Yeah. Out of trauma informed care, prioritize safety, dignity, and healing. Okay. So if there is a risk, please involve the social services or citizen bureau or police. Yeah. Use compassionate multi-layer intervention. Don't directly jump to the trauma. Use layer kind of thing, make the patient comfortable. Yeah. So in our term, I've worked in Liverpool as well as in the court training. The number of services we have: trauma-informed services, IMDR, CBT, validation of a survival experience, comprehensive safety planning. Okay, so risk assessment is also done. Yeah, and move to the next one. Now the main thing in domestic violence is safety and safe environment. You assess a patient with domestic violence and you say, okay, thank you very much, please go to home. And you are living with the same person with domestic violence. You cannot do that. Recently I've looked at the internet. There are a lot of cases where you just see and you say just patch up and go home, and they have been murdered, homicides. Okay, so please, safe and environment is you need to do it. Better intervention program. So this you can do it with the social services and police. We need to work together in the multidisciplinary way. Concurrent mental health. If there's some mental health treatment, mental health problem you need to address and treat it. Treatment never replaces accountability. That means when you provide treatment, that doesn't mean that it's going to stop with the perpetrator. Okay, so accountability should always be there. Yeah. Now, how we can break the cycle in the coming generation? Witnessing violence is development trauma. Okay, so if you have witnessed any trauma, it develops this indirect trauma to yourself also. So aware of that, you need to break that. In children, especially if you have got kids, play therapy, school-based support. So the children also need to be educated about domestic violence, which are the behavior which is acceptable. And if you look at some of the study, you can see that in the schools where there's a bullying or harassment, those are the group of people that there's high chances for them to do domestic violence when they grow up. Yeah. Support non-offending parents for stability. So even the parents, as grown-up, we also need to be educated. That doesn't mean that we don't do it, so we should not be educated. Sometimes knowingly or unknowingly, some of the cultural element also comes to us, and we might be doing it without our knowledge. So sometimes it's also good for us to educate ourselves with new things that's coming. Yeah, go to the next one. Now, these are some of the things which the HMRC and the social services have put in place. That the strong emphasis needs to be in the early education. Expansion of specialist resources and training needs to be there. Okay, so if you guys have an opportunity to go in some of the trainings like this, please go. It helps to improve ourselves. NHS we tend to do a lot of safeguarding. Level 1, 2, 3. Okay, it's not just doing your e-learning. Okay, just try to see how I can apply those in my real life. Yeah. Now in UK, they have spent almost like 20 million in the last 2 to 3 years on strategy, training on consent and what do you mean by this?
Misogyny. It's all about like male gender roles and I don't know how to explain it.
Is it like discrimination, discrimination based on gender?
Yeah. So we also need to be aware of that and training on consent. What is consent? Consent. No means no. Okay. Mentally healthy schools and breaking the silence. If that has happened, you should provide an opportunity for people to speak up. You should not say, this is an adult topic, so please stop up. This is not your area of expertise, so you shut up. So that should not be the environment needs to be provided. Okay, go to the next one. Now, these are some of the helps that you can seek. Okay, the reason that I'm involved in a lot of social work and this and that is I've come across a lot of people. I tend to do podcasts as well as I tend to do a lot of talks to other people. Sometimes those people don't feel comfortable and they send me a lot of messages in my Instagram and this and say, please can I speak with you, because they don't know which are the help that they can seek. So I've directed multiple people in the last 1-2 years to different kind of this services, and after that they have received the right kind of help. Yeah. So domestic abuse helpline is there. Especially you can see this with have you looked at the recent newspaper where a parent with children with 3 learning disability killed himself as well as killed the 3 learning disability because of they were not able to tolerate and their funding was stopped. So if they have received the right kind of help and support, that incident would have been prevented. Non-urgent help, okay, PIRIS, there's a youth suicidal prevention, and there's one more services where you can talk freely to them. What was that service? Samaritan. Yeah. So if you guys are interested, in the local Samaritan, you can even volunteer. I've done 2 or 3 sessions, without telling that I'm a doctor. So it's a good opportunity, and in that Samaritan, you don't discuss about the mental illness and this. It's just a support, an opportunity to talk. Yeah. Child services there. Professional, okay, and we as a professional, we also has a duty, okay. Us being knowledgeable and coming to work and getting money should not just define what we do, okay. We have got a lot of resources that we can provide, okay. So sometimes I volunteer myself to go to kids school to talk about these things. Yeah. Can go to the next one. Sorry, let me just cancel this. Okay, so this is the last slide. Okay, now as a professional, I would ask you to adopt this kind of approach. Okay, when you do the safeguarding, it's not just doing e-learning. Yeah, when you find this kind of patients, especially if you are in pediatric or GP or psychiatry or whatever you do, then you need to recognize the signs. Number 1, recognize the sign. Okay, respond appropriately without any kind of like judgment. Yeah. Report to the right person. Sometimes you might not be the person to do everything. So if you are doubtful, request your seniors who have got more experience in A&E or in this. We have got safeguarding team or guardianship in our trust, so we can ask an opinion. How to move forward. Details accurately. So whatever you have gone, accurate detailing. Okay, because sometimes people who fake it might change their statement on and on. Okay, refer to agency if needed. Now, forget about whatever you have learned today. If you are able to take this and apply, that would be great. Abuse is a choice rooted in power and control. Yeah, mental illness may be the cause, consequences or two, but mental illness per se is not only the reason why people do domestic violence. Intervention will be trauma focused. Education is central to prevention. So even if okay, we need to interact with more people in order to practice the thing that we have learned. I think this is the last one. Yeah. So the main thing is we need to see that there are a lot of people going through domestic violence. So if they approach you, you might change their life. My experience in the last 2-3 years is since I've done a lot of this podcast and talk, a lot of people have approached me indirectly. they want things to be done, confidentiality not to be done. Just speaking with them, I think I had one lady, who was trying to attempt suicide. She didn't know how to approach. So I spent almost like 2 or 3, sessions. I met her personally, face to face, and I directed her to, appropriate channels. Now she's back on her track. She broke up the relationship from the toxic relationship, and now she's in a happier relationship. The other important thing which I also want to say is the domestic violence. Can you take a guess how much percentage in UK, female to male? Female to male.
To who's suffering or who
No.
does it?
Female doing to male.
Oh, right.
Yeah, from the total data.
A third?
1/4. 1/4. And male doing to female is 1/3. Okay. Keep in mind that there's also a lot of cases of fake domestic violence. Okay, so don't reach to the conclusion that is a male, he's stronger, so he's doing the abuse. If you look at the case, it might be the other way around. Yeah. Okay, so just checking. From this presentation, have you got any question for me? So after this presentation, what different are you going to do? If you encounter any of the patient like this? How about you, Katie?